when we do cognitive assessments in diverse populations in Europe, especially among the older populations, many of the older people have come to Europe as working migrants, especially in the 60s and 70s, and predominantly from the Middle Eastern countries and North African countries. And many have come from rural areas with a little formal education. And even in old age, we often experience many have limited fluency in the dominant language in the host country. So that leads to a number of challenges when we try to do cross-cultural assessments in these populations. And the challenges are mainly related to diversity characteristics in terms of cultural differences, language differences, and educational differences. To give an example, the commonly used mini-mental state examination may be very difficult to perform by a person who does not know Italian language very well if it's administered in Italian. And if that person has limited knowledge about, for instance, Italian geography of Italy we're in right now, and especially in terms of the requirements of skills obtained through formal schooling, including reading, writing, doing math, and even drawing might be very, very challenging if you have no formal education. So that's some of the main challenges that we face when we try to do cross-cultural assessments in older populations in Europe. However, a number of more recent developments have happened in Europe in terms of developing better assessment skills or cognitive tests for these populations, especially within the ECRON, which is an acronym for the European the European Consortium on Cross-Cultural Neuropsychology, with members from many different European countries, including Italy. We are actively working on developing and validating new instruments that can be better used in these populations, including the Roland Universal Dementia Assessment Scale, the Cross-Cultural Dementia Screener, and the European Cross-Cultural Neuropsychological Test Battery, to name a few. But more studies are on the way, trying to improve cross-cultural assessments in older immigrant populations in Europe.